Helen Minnis is a professor here at the University of Glasgow. She's a mentor in attachment in general, this constructed accounts of the relationship between children and parents. And today we talk about reactive attachment disorder. Can computers detect it better than humans? So Helen, the floor is yours. Thank you.
Thank you very much, Alessandro. And thank you for that wonderful talk, Nicholas. And actually there's a lot of, it's got me thinking about my own patients. So I'm going to start by just giving a really brief overview about attachment. To state the obvious, babies communicate. So this baby might be saying, Dad, you've got a very intriguing nose. Or he could be saying, Dad, I'm hot. Dad probably has a better idea than anyone else. But not all communications are attachment behaviours, which I think relates very well to the previous talk. So the nature of communication and attachment is instinctive, urgent, and noisy. So you've all heard a crying baby and it makes you want to either run away or do something. So this baby might be saying, Dad, I have a horrible tummy. Do something about it now. And so what it prompts, it's an instinctive behaviour. And what it prompts is an instinctive caregiving response in the parents. And this has been shown in fMRI studies that if you play a parent the sound of their baby in an fMRI scanner, lots of the frontal lobes will light up. So attachment is a fundamental human instinct. It works across all species. And that's the fascinating things. You know, birds will clump when there's danger. Even amoeba in a petri dish, you put the toxin in one end, they clump. And it's probably very physical that it reduces the surface area of the group. But when a young human infant is stressed, he or she will seek proximity and comfort. And in humans, it's virtually always noisy. It usually involves movement. And it keeps us close to our herd. So if you think about it, we're supposedly most adapted to being hunter-gatherers. And if you're wandering across the plain and an infant becomes separated, then obviously you want to know that. So the infant's going to make a lot of fuss so that no one leaves behind. In humans, attachment is traditionally measured at 12 to 18 months using a technique called the strange situation procedure. And the reason for 12 to 18 months being the ideal time to measure attachment is because virtually all of the behaviour is encapsulated in movement. So it's really easy to see. You know, the infant will run towards the parent when they're distressed if they can move. They'll reach their arms out to be picked up. The strange situation has been described as a drama in 8 episodes because it's essentially very replicable doses of stress created by separations and reunions of the parent and the infant in a laboratory playroom. But really, the strange situation, even though there have been thousands of studies across the world using it, it really hasn't translated into clinical practice as a tool because it's very labour intensive, very expensive to train in it. You have to go to Minnesota, you probably fail the first time. I mean, it really is, the barriers are huge. But in all of these studies, what has been shown really across the world, and this is even true in shanty towns outside Cape Town in South Africa, really stressful environments, about 60 to 70% of dyads, and when we're talking about dyads, we're talking about the mother-infant pair, or if you could do it with the father-infant pair, but it's a feature of the pair. So 60 to 70% will be described as secure. And really what that means is that the infant makes a lot of fuss and then they're very quickly calmed down by the parent. And then about 30 to 40% of infant parent dyads are described as insecure. And I'm not going to bore you with exactly what that means, but it's not so optimal in terms of dealing with your stress responses. And there's another way to look at attachment. You can also look at organised or disorganised attachment. And disorganised attachment is interesting because it's as if infants don't really quite know how to deal with the stress. And that's been shown to be about 10 to 15% of the population, and that varies across cultures. But another really, really good time to measure attachment is the early school years, partly because you have an opportunity to reach the entire population of children because they all go to school. And a well-validated measure is the Manchester Attachment Story Task, which essentially does the same thing as the strange situation, except it uses a doll's house, and you see the separations and unions of the dolls, the mummy doll and the child doll. And you can also rate the speech, the narrative form from the child, as well as the behaviour of the dolls. But neither the strange situation procedure or the Manchester Child Attachment Story Task have ever been able to be used in really big studies. So I'm trained in epidemiology, and I think, you really want to test tens of thousands of mother-infant pairs if you want to know interesting things like the behavioural genetics of attachment, or how does attachment relate to psychopathology on a very large population scale. And those studies really have never been done because it's going to cost you, it's basically going to be prohibitive to use these measures on more than about 200 children. So Alessandro, Stephen Brewster, and a group of fantastic postdocs and myself have developed the School Attachment Monitor, which I'm just going to talk you through. So here on the left, you have a picture of the apparatus, and we've made it deliberately as simple as possible. So the computer screen, basically using actors, tells the child the story stem. And what I mean by a story stem, it's the beginning of a story that comes to a kind of crisis point of stress. So, for example, a child is playing football in the playground and suddenly they fall and they hurt their knee and it's bleeding. So, you've got some stress. And at that moment, the child is asked to take over the story. They've got a great big button that they can press if they want to stop at any time. These are the dolls, and we've got a really simple two-dimensional fuzzy felt house, which amazingly seems to work well with children aged 4 to 8. And these are the dolls, and what we did was insert sensors into the dolls so that it was possible to actually record the movements of the dolls. So it's based on the Manchester Attachment Story Task. What we did was we manually rated the task. So manually rated the videos of the child and the movement of the dolls. And then we for the first group of children, we used both the doll play, the original doll play, and we also used Sam for the same child a few weeks apart. What we found was really excellent concordance in the manual ratings of the two tasks for both secure versus insecure and for organised versus disorganised. But I have to say, all of that manual rating, I'm not kidding, it took about 500 hours for the team altogether. And then Alessandro, and I'm sure he can tell you more about it if you want to ask questions at the end, developed a machine learning algorithm, which actually showed over 80% concordance for secure versus insecure with the manual ratings. So really very positive, encouraging results. So a lot of work still to do, but potentially, Sam, could allow automatic attachment measurement in large studies, which for me is the holy grail. It could potentially be used as part of screening for children likely to go into mental health problems. So none of the existing screening instruments for mental health problems in children really are good enough. And I have this hunch that maybe the two together, Sam, and for example, the strengths and difficulties questionnaire might together, be a useful screening technique, but more research needs as part of ordinary clinical protocols. And in fact, we've recently had a request for a team that does neurodevelopmental assessments who want to routinely look at attachment at the same time, which is probably very useful because it would give you a sense as a clinician of what is the kind of current state of the relationship between the child and the parent. And there's a preprint for that, and hopefully we'll soon have it actually published, cross fingers. So I want to change tack now because insecure attachment is very common in the population, but we've now moved on to look at a much more severe and rare problem. And this was a memorable conversation. A few years ago, a group of clinicians, including myself, we were asked to talk about implementing the NICE guidelines on attachment. And one of my colleagues, Suzanne McCrae, who's an extremely experienced clinical nurse specialist, who's worked for many years with children in the care system. And I have to say, Suzanne isn't someone who particularly likes diagnostic categories. But she said, in my view, failure to seek comfort is the most important symptom to look for in an abused and neglected child of any age. And I absolutely agree with her. So as a clinician, there's always children that stick in your mind and you just wonder how they've got on. And I would say the child that's most true of in my clinical career is a boy that I first saw when he was 9. He'd been placed in an adoptive placement at the age of 4.5. And the first month was a honeymoon. And then after that, he just very quickly became withdrawn and contemptuous of his adoptive parents. They described him as just resisting the relationship. He would never go to them with comfort or for problem solving. This is just such a sad quote. His default setting is misery. He would frequently dissociate and blank. He also had a severe problem with gorging, which is an even more rare syndrome that goes along with very extreme early abuse and neglect, which he had suffered. He was very compliant in the classroom, but very aggressive in the playground, stealing children's food. Very extreme abuse and neglect. He'd actually been noted to be wandering the streets in his pajamas at the age of 21, but he wasn't placed in care until he was 4.5, and that was very traumatic because they were trying to arrest his big brother at the time. And when I saw him, the adoption was on the verge of breakdown, and I wonder, I have no idea what's happened to him since, I'm afraid. But we have written this up as a case report, this and 2 other case studies of children with persistent reactive attachment disorder. So I've just given away the diagnosis, but this little boy was diagnosed with reactive attachment disorder, which is characterized by a failure to seek or accept comfort, emotional withdrawal, limited positive affect, default setting is misery, unexplained irritability, sadness or fearfulness, which makes sense when you think about attachment. You know, what is attachment for? You know, you're supposed to go to your parents for them to help you with things. And if you never do that, or if you rarely do that, then, well, you know, you're not going to learn how to regulate yourself. And you would only make the diagnosis of reactive attachment disorder in the context of abuse and neglect. And also if it's pervasive. So you'll remember me talking about attachment, insecure attachment being an assessment that you make of a relationship. Reactive attachment disorder is different in that the child sadly takes this with them wherever they go. So it's going to cause them problems within every relationship. We did a study a few years ago looking at the prevalence of reactive attachment disorder. Confusingly, it's the old terminology because they used to include another syndrome in this. But reactive attachment disorder, as I've just described it to you, is rare in the general population. We screened 1,700 6 and 7-year-olds, and we only found 1 child with pure reactive attachment disorder. However, it's probably rare because if it's dealt with in the early months and years of life, then it usually melts away quite quickly. So if the child has been abused and neglected, but they're placed in a loving, nurturing foster care placement or adoptive placement soon enough, this usually just melts away. But if it doesn't melt away, if they haven't been placed in a nurturing placement soon enough, then our research suggests that things can go very badly wrong. So reactive attachment disorder is not rare in forensic child and adolescent mental health. So in other words, children who have both mental health problems and a criminal history. And we've also recently, we haven't published this yet, but we've done a study in a prison and a young offenders institute, and 17% of the young people had fulfilled diagnostic criteria for reactive attachment disorder. So what does it look like in older children and adolescents? Kind of like that, you know, just withdrawn from the world, pushing away anyone that tries to help you, which clearly isn't helpful if you want to develop your full potential. And how do attachment patterns relate to attachment disorders, to reactive attachment disorder? Well, as I've said, about 30 to 40% of the population, the general population, would have an insecure attachment with one or other of their parents as a young infant. So that's not abnormal. But only a very small proportion of the population have reactive attachment disorder. And I would suspect that in order to develop reactive attachment disorder, you probably have to have insecure and or disorganized attachment and abuse or neglect. Perhaps also neurodevelopmental problems like ADHD or autism, because not all children who've been abused and neglected develop attachment disorders. So why is failure to seek comfort so important? If your attachment needs are not being met, you can't possibly develop adequate regulation of your emotions because you need parents to help you with that. We know that 30 to 40% of abused and neglected children in the care system. Oh, sorry, I didn't mean to do that. Will self-harm. So, you know, that's a sign of really poor self-regulation. We know that violent offenders almost universally have a history of abuse and neglect. And 2 out of the 3 young people that I've had the opportunity to treat clinically, older young people with persistent reactive attachment disorder, have either experienced actual family breakdown, which is a devastating thing to happen. You know, you've been adopted and you've got a loving family and then it doesn't work, or they're on the verge of it. So it's a terrible, terrible disorder if it's not recognized early, but it's so easy to treat. So if it's spotted early, then we support foster carers or adoptive parents to use what we would call gentle challenge. And that's basically to kind of offer children, to kind of gently nudge children, warm them up into accepting help, a bit like a horse whisperer. And if foster carers can be supported in doing that, then, you know, these symptoms generally just melt away. And then if the problems are more complex, there are specific treatments like video interaction guidance or child-parent psychotherapy that seem to be helpful. So I'm just going to show you a couple of videos. Now, please wave, Alessandro, if you can't hear this, but I think I've shared the sound, so hopefully it will work. This is a video of a strange situation procedure, and this is a secure dyad. So this mother and infant, she's about 15, 16 months of age, they've been classified as securely attached. This is the moment in the strange situation where mum is asked to leave the room and leave the young infant on her own. And you can hear some researchers behind, mum comes behind the screen.
Upsetting for you. Sharon, I feel.
Don't worry about what they're saying. The most important thing is the little girl.
The key moment in the experiment is the child's reaction to her mother's return.
The important clue is whether the baby's able to become calmed down by the contact with the mother, get back to play. Sometimes it takes a couple of minutes. You see, when the mother was out, she was only interested in the...
Oops. So, move on from that. So, as that's Everett Waters, I think, as he says, the most important thing there is the intense distress. You know, when I show this in workshops and I say, how do you feel? I mean, everyone's like, oh, it's horrible. It's not pleasant to watch. Actually, the minute mum comes back, she's able to comfort the little girl and she's back on to looking at the environment. So actually, secure attachment gives the child the maximum opportunity to learn because they're very quickly soothed. They know how to get mum to come back in the room because they make a noise, get her back. They're quickly soothed that they can get on with learning. So don't anyone take screenshots for the next few clips because I've got permission to use this, but you know, I wouldn't want it to end up on the web or something like that. But this is a little boy in one of our studies who we've ended up having a kind of accidental strange situation happening here. Ours is it's a different type of scenario, but it's even more stressful for the little boy who's about the same age because there's a stranger in the room. And so Rebecca, our research assistant, has only just met this little boy. And this foster dad, and the boy's been placed with this foster dad long enough to have developed a secure attachment because it doesn't take long. And he's been in this place for about 3 months. So foster dad suddenly needs the toilet and leaves. So let's see what happens. And just remember how noisy the secure dyad little girl was.
See if you just go just like straight down the end, it's just the last one on your right. I'll be back in a minute. You can show me what you're doing.
So there was attachment behaviour there, but it was quite pathetic. You know, he goes, that's it. No crying, not much noise. Now watch this next. So basically he's on his own in a room with a stranger.
These over here. Kevin will be back in a minute. You have fun? Like a puzzle? Yeah? Are you hungry? Yeah? You're looking forward to something?
Alessandro pointed something out to me that I would not have actually realised, which is that the movement of the left hand there is a classic sign of stress. I'm going to let you watch that again. You know, in adults, it can be this kind of thing, but this little boy is really stressed. So you can imagine when you watch this again that his heart's going like this and his blood pressure is probably high.
These over here. Kevin will be back in a minute. You have fun? Like a puzzle? Yeah?
And in that context, the remarkable thing is that he manages to be polite despite it. Can you imagine if a stranger had asked the previous little girl if she enjoyed her lunch during that? I think I've got an answer, but this little person's like, oops. So let's see what happens when foster dad comes back.
Tell you I was going, Matthew.
Right.
Finish with the toys.
Yeah. Gonna bring in lunch.
Oh, we're going to have lunch.
So actually, he looks between the stranger and the dad, and I would imagine that he just stays pretty stressed because there's no opportunity for him to be comforted. So you can kind of start to see why failure to seek comfort is so often missed by the human eye. We're programmed as adults, as I mentioned during the bit when I was telling you about attachment, we're actually programmed to be distressed by children's noise and to soothe them. So we want to shush distressed, noisy children, and it's instinctive. So if a child is silent, it doesn't stimulate our caregiving behaviour. And reactive attachment disorder is characterised by negative symptoms. So in other words, a lack of comfort seeking, social withdrawal. It's an absence that characterises it. And so in my experience, by the time a child reaches clinical services, which is usually well after the age of 5, they're likely to have developed many more obvious problems like aggression. And the way that we could assess reactive attachment disorder in the under 5s, we do have validated tools. So we've got questionnaires for parents, we've got diagnostic interviews for parents. We've also got a well-validated observational tool, but it takes, believe me, months to train in and hours to rate. So nobody in their right mind would ever use this clinically. And anyway, most of the children are not being spotted under 5. Generally, nobody notices. Very depressing because it's so treatable. So I asked Alessandro to look at some of our videos a few years ago. And what Alessandro, I must say, I think this is a labour of love because it's not exactly fun to sit and look at a corpus of videos. But it was so interesting because as a psychiatrist, I'm trained to really think about the neck up. And what Alessandro noticed, one of the first things he said to me was, their legs don't move as much as other children. And as soon as you said that, Alessandro, I thought, oh, that's actually really true, because of course they're frozen. So it actually, made me think I should look at the whole body. And so we thought, well, this may actually be something that could be picked up on computer, and maybe could be picked up on computer better than humans can pick it up. So Alessandro and I are supervising Andre Birladiano. I'm not sure if I'm pronouncing that, that's terrible, I just call him Andre. But anyway, to examine this. And we've got some fascinating early findings about speech. So, I mean, I've left plenty of time for our discussion actually, because I'd be quite keen to have Nicholas's view about this. But and I don't want to kind of steal Andre's thunder because he's just writing this up. But what does seem to be very clear is that there's a reduction in the overall amount of speech, which seems kind of a bit of a no-brainer. But because humans are primed not to notice it, if it's possible to develop a machine learning algorithm that can actually notice this, then this could really be very, very helpful clinically. And our plans would be to think about movement as well, because we've noticed that that kind of frozen sense is also very important in children with reactive attachment disorder. So, and this has really come from Andre's looking at the literature, but social signal processing, as Nicholas was saying, is emerging in child psychiatry. It hasn't really quite hit clinical work as yet, but there was some really quite seminal work back in the 1990s, again with people laboriously, manually analysing autism birthday videos. So I think it was children who developed autism, and what they did was they asked a group of parents to provide videos of the first birthday party. And of course, one of the problems with that is it's very uncontrolled. We don't know whether there might have been lots of meltdowns that certainly the video was turned off for example. And then there have been dimensions, really characteristics examined in healthy populations. I should say healthy, not health. So the emotional quality of speech, facial expressions, people's pose. And again, I mean, Alessandro is vastly more expert on this than I am. But I've often wondered whether the reason that social signal processing hasn't really had the impact that it deserves in, not just in child psychiatry actually, but in many psychiatric areas, is that actually psychiatric problems are quite easy to spot with the human eye. I mean, be interested to to hear what Nicholas says about depression, but you know, you can, the most valid way to find out if someone is depressed is to say, do you feel depressed? And if they say, I feel so depressed, I'm ready to kill myself, then probably onto something. And then there are also features of, you know, we talk about psychomotor retardation, where, you know, I'm very animated, but if I was depressed, I would actually speak more slowly. And it can be that stark. So, I mean, depression does get missed, and psychomotor retardation and depression does get missed. But most child psychiatric disorders are readily observable. So children with ADHD, for example, are obviously hyperactive. You know, they will wreck your clinic office, and impulsive. You know, they'll grab for things and then feel really bad because they've broken it. Conduct problems, you know, aggressive children, you can't miss it. But we've just been amazed at how not just parents, but clinicians just miss reactive attachment disorder, even when it's really very stark. And I think that's because we're programmed to miss it. But the results of missing it can be devastating. So for me, I think it's a really ideal target for social signal processing. And all I can say is watch this space, because we're really just starting on this. And that's really all I want to say. I've left plenty of time for questions and comments.
Okay, thank you. Thank you very much, Helen, for this very interesting talk. So are there questions for Helen?